Dr. Kothary, the Chief Medical Officer for Dignity Health in the Central California Division, is joining us once again this morning to answer questions about the coronavirus and the latest research. Dr. Kothary, thanks so much for joining us. We appreciate it.
Oh, absolutely, Maddie.
All right, well, Dr. Kothary, yesterday we did a Facebook Live after 17 News at Sunrise, and we got a lot of questions from viewers, and we didn't get to all of them, so I wanted to answer or have you answer a few more of those this morning. One question we got, now this is something we heard last week from Dr. Dan Erickson and Dr. Artine Masihi of Accelerated Urgent Care, talking about staying sheltered and how that affects your immune system. And a viewer wanted to know, will being sheltered and staying away from germs of all kind affect your immune system? Can it lower it?
Absolutely not. You know, germs are ubiquitous. They're all over the place. So if the only way you would lower your immune system is if you lived in a bubble. So I don't think that's a very accurate statement at all.
Let's talk about the latest developments in the plasma treatment. We've been talking about this every day, but it is brand new and it is evolving. And yesterday, Houchin Blood Bank came out and announced some new successes, saying that at least one local patient was able to go home almost immediately after receiving this treatment.
Yeah. So, you know, I think it's one of these miraculous drugs that we have in our arsenal. You know, we've heard of remdesivir, but I think the plasma treatment is going to be the way to go eventually. I just think it's amazing, and what the community is doing by donating this plasma to the patients that we have in our hospitals is great as well.
And we've talked a lot about how you can donate. You have to have tested positive at some point, but also you've said recently that someone who has received an antibody test showing that they had the antibodies and then now do not have the active virus can also donate plasma. But we also know that these antibody tests are not 100% reliable. Is there a chance that someone could think they have the antibodies, not really have them, and then go on to donate plasma that would be given to a patient and it just would have no effect whatsoever because that person really did not ever have coronavirus?
Well, you know, as long as you have a positive test and you've been 14 days out and without symptoms, I think you're going to develop antibodies. The problem with these antibodies, there is an issue, is they have a high false positive rate. What that means is a lot of people show positive antibodies and don't really have antibodies towards COVID. So even though the test may be false, you're still going to have some antibodies. We don't know how much and how many people will develop how many. It just depends. It's going to be a very variable thing. We're still trying to learn about this plasma treatment, but we know you'll have some antibodies for sure.
So is there a possibility, though, that someone could donate plasma and it could be used but be ineffective because they got that false positive and they really did not have an immunity to it?
Well, they'll have some immunity as long as they've had a true positive test of COVID-19. They'll develop antibodies. Everybody does. But at what rate is what we don't know. So some people may develop it 3 weeks after having COVID. Some people may develop it a week after. That's the part we don't know. What
if you never got the positive coronavirus test? You just got the antibody test after the fact?
Yeah, we're not letting anybody just donate just based on the antibody test.
Okay. All right, a couple more questions coming from our Facebook Live. Someone was asking, is it okay to be out around family members as long as you're still socially distancing? I think I've been seeing this a lot more around social media, people having meetups in front yards and setting their lawn chairs 6 feet apart so that they can see the people that they haven't seen in so long.
Yeah, I think as long as you keep it to small groups and you do socially distance, I think it's fine. You know, I think people are getting anxious and they're worried about not being able to see friends and family. So I think, you know, small groups, socially distanced, I think you're fine.
And then a lot of people are still asking, as we've been talking about these last few days, about those with pre-existing conditions. And one that someone asked about yesterday, actually we had a few questions about whether or not pregnant women are at higher risk of either contracting the virus or having severe outcomes.
No, they're not. Pregnant women are just as likely as anyone else to contract the virus. And, you know, we have algorithms set up in hospitals that if a pregnant woman comes in, what we need to do to make sure she's protected, we're protected, and the baby's also protected as well. So they're not at any higher risk than anyone else.
Okay, it's just whether or not when they come into the hospital, what could be the outcomes, then the repercussions of them being diagnosed with this in the hospital. And then finally, we talked about this a while ago. Should very young children wear masks? out in public?
So the CDC guideline says anyone below the age of 2 should not. And logically, it's because anyone under the age of 2 is going to touch their mask a lot. They're going to pull it off their face. So causing more harm to them if possible. So we're telling everyone under the age of 2, don't give them masks.
Okay. Is there a potential of that harming that child's breathing also? These are very small children.
You know, these masks, some of these masks, especially these cloth masks, are very thick. And if you put one on, it's sometimes difficult for you to breathe as well. So we try and leave it to someone above the age of 3 that can communicate that to their parents.
Okay. And should you watch your children carefully and make sure they don't wear them for a long period of time?
Absolutely. You know, and the thing is, once you take the mask off, don't put it back on until you wash it as well. That's the other piece of advice that we'd like to give everyone.
All right, Dr. Kothary, thanks so much for joining us, sir. Dr. Kothary's been joining us every morning on 17 News at Sunrise to answer questions. So if you have more questions for him, please let us know, and we will get to those tomorrow. Dr. Kothary, thank you very much. Have a great day, sir.
Thank you, Maddie.
And we'll be right back.